All right, let's do this. Go
Okay,
ahead.
you ready?
Mm-hmm. Quick.
So, chapter 25, microbial diseases of the cardiovascular and lymphatic systems. Can you name all the diseases?
What? Is that on there?
It's not, but let's start there.
Yes, of course. So all the skin infections. Wait a minute. This is I want to do skin infections.
You want to do skin?
Yes,
Episode 25.
I lied, and I'm sorry.
Skin infections. All right. Okay, so name all the skin infections.
Sorry, guys. Okay,
Name one infection.
all the skin infections within chapter 25 include hair follicle infections, also known as folliculitis, chicken pox,
Got it.
shingles, which are two separate diseases. Am I in the way of this thing? Measles, rubella, necrotizing fasciitis,
Yes.
which is the thing that eats flesh. So it's essentially the zombie disease. Gas, green, and tetanus. Yeah, I said that.
There you go.
That's not the zombie one.
It's not. Which one is the zombie?
No, the necrotizing fasciitis, your skin just falls off. The zombie one is the one where I think it's a fungus that gets in the brains of things.
Whoa,
Yeah.
that's horrible. Okay, well, never mind.
I don't think we learned that one.
No, we didn't learn that one.
No, we didn't. They have other stuff.
I think it's more
Well,
in
I'm just-
mice or it's
well-
in ants.
Well, necrotizing fasciitis, they call it the flesh-eating disease. So that's the only reason why I attributed it to zombies. But I think there's a lot of these viruses. Like,
It doesn't make you want to eat flesh. That's
no,
what
I
I'm
didn't.
saying.
I don't. Wait, what wants to eat flesh? You know what? Next
Zombies.
question. Next question.
Okay,
That's
so
not my flow. It's funny.
okay, so this is from
The question.
top, yeah.
Okay,
So
do it.
list three major virulence factors for Staphylococcus aureus.
Okay, well, I have for Staphylococcus aureus salt desiccation, tolerance, which means the bacteria is able to thrive in salt, coagulase disruption, I believe, and then toxins, and then biofilms, which is 4. So, what's a quick way to remember that? SCTB. No, I don't know. I don't have anything. But salt desiccation tolerance, coagulase disruption, I believe, and toxins for Staph aureus and
I
biofilms.
don't think it's disruption. I think
Look,
it's-
this is coming from our slides. So,
No, but I mean, aureus, when you do the rabbit serum, it's a positive, so it actually.
oh, I
makes
see what you're saying.
things Clot. Not.
So it makes things clot.
Yeah.
Well, let's see if this makes sense. Yeah, well, that would make sense because when you have a hair follicle infection, the follicle is infected. So I don't know. Yeah, I don't know. Yeah, maybe.
To shift it, great.
I'm not sure. I'll double check on that one.
The rabbit serum clots is a positive.
Is a positive reaction? That's true.
Yeah.
Okay.
It's the other one, like the hemorrhagic fever, that
That does the anti
clotting goes the other way.
goes the other way. Okay. All right. Next question. Thank you.
Define MSRA.
Methylene resistant Staph aureus. Yeah.
Dude, how we get 14.5 on our project?
It's out of 15, and she took like 0.5.
We lost 0.5 as well. I don't know what we did. I don't know what we did. What's the
How are we
next?
losing that 0.5?
What's the next question? I'm live streaming here.
Okay, so chickenpox and shingles. List the causative agent for chickenpox
The-
and its transmission.
The causative agent for chickenpox is varicella zoster, and specifically it's varicella, which is the causative agent, and the root is respiratory, the respiratory root.
That's the transmission?
Yes. Next.
Okay, let's see. Let me give you one that you probably are not.
Okay.
Explain the relationship between chickenpox and shingles.
Certainly. So,
Very first.
no, I'm gonna do my best. So varicella zoster causes 2 separate diseases, right? Herpes zoster creates shingles, whereas varicella zoster, varicella is a causative agent for chickenpox. For chickenpox, you get a rash and a vesicle that's filled with pus. It's severe in adults, mild in children, and there's a high threat to babies, like a very high mortality rate for babies with chickenpox. So, but mild in children, but very high in babies. And I think that could be like a quizable, because you know when you were a kid and when you're a kid and you had chickenpox, you're fine. But if you're a baby and you have chickenpox, that's no bueno. And the reason why it's severe.
That, I remember.
Do you?
Yeah.
Yeah. That one.
Like high mortality rate or something. for
Yeah.
babies.
Because you wouldn't think about it, because you're thinking children, babies, same thing. You might mush those two together, but make sure to separate them. Just think about when you were a kid and you had
Serious
chickenpox.
I grew up very serious in newborns.
Very serious in newborn? Okay, cool.
So here's
Same.
another question.
Okay. I
Uh,
wasn't done with.
oh, you are?
No. The only thing else I need to add for shingles is shingles, the signs and symptoms are blisters. And then there's a vaccine available for both of them, but the vaccine is for over 65 with shingles. And then it's mostly older adults that are affected for shingles.
Okay.
And it's due to stress and aging in the immune system. And the really important thing is that the virus will be latent in the nerve ganglion for shingles, and the virus will be latent in the nerve cells for.
Chickenpox.
Thank you. Get my brain to work. Finish your sentence. I'm just so sorry, guys. So nerve for chickenpox. Like just think, chickenpox gets on my nerves,
And shingles.
and shingles gets on my nerve ganglions. Next question.
Pretty much the answer.
Whatever.
How is that different?
How's it different? The nerve ganglion is like a bundle, whereas the
Yeah.
nerve cell.
Have you taken an anatomy?
No.
I haven't
So-
either. But I just remember.
Before, like, it spreads out, like, your nerves like that, especially in your face, you have, like, this fat root that everything connects to, and then branches out from there.
Oh.
So that's your ganglion.
Nerve bundles, that's the name.
Nerve bundles, but remember ganglion.
Does she have us right?
So the ganglion is at the
Within the
the
lecture
root,
sites.
and the nerves that they're referring to are like at the
I mean, you can
surface.
think of it as like a root in a way. It's not necessarily a root, it's just like a big clumping where all the smaller branching ones kind of meet up, and then it continues on up to the CNS.
I wrote latent virus in the nerve bundles.
You see bundles?
That's ganglion.
Ganglion.
Reactivated and reached the skin.
Yep. Next question.
You just finished all the chicken pox.
Perfect.
All right, let's go on to the next section.
All right, let's infect.
Measles.
What about it?
List the characteristic symptoms.
Okay, measles, rubella, which is spelled Ruboela, is a virus, and the name of the causative agent is measles virus. It's respiratory, and the thing about it is there's a primary rash, fever, and a cough with Koplik spots. And secondary, unfortunately, can develop ammonia and encephalitis. Encephalitis is inflammation of the brain. And there is a virus available. However, with measles, which is really unfortunate, is it's very ineffective for children under 1. So the way to remember that is Disneyland. When there was an outbreak, it really affected a lot of people, and it was really unfortunate. Why are you laughing? Oh my God. Evil. Outbreaks tend to be individuals who come, like visitors from other places, come and visit, because usually measles. Why are you laughing too? What is wrong with you guys? Oh my God.
That's not what I mean, look.
Funny.
Okay,
What is so funny? Disneyland
so
measles.
I
It is a
don't-
horrible thing.
So the best method of prevention.
The best method of prevention is vaccine.
That's the best.
Overpriced drinks, long fucking wait line.
I've never been. Anyway,
Unless you have a kid.
the pathogenesis is that it suppresses their immune response, is highly contagious. Remember, one person had it and then it spread to very many people, and it spreads throughout the entire body. Next question.
So who's at risk?
Little children under 1.
Perfect, as long as you know that.
Next.
And just know that there is a vaccine available.
There is a vaccine.
There is a vaccine
Best
available.
method of prevention is vaccine.
Vaccine, but it doesn't work if you're under 1.
Is there any kind of like,
Next question.
I don't think
Is it rubella?
Also, the rash is not itchy.
Yep, I said
Don't know
that.
if she'll fucking say that.
What is it?
The rash is not itchy for measles.
Oh, I'm gonna add that. Where's my
List of
marker?
characteristic symptoms. What did you say? Rash is not itchy?
For measles.
Not itchy.
I guess I can go under characteristics.
Maybe, but I have a doubt she's gonna ask that.
Okay, next question.
I think she's gonna look for word from this.
Shoot.
Too much crap. Rubella.
Rubella
How
is
fast
a.
with measles in terms of symptoms and severity in young children.
Okay, I'll go. So I'll go right to the separate. So, Bola and rubella. So rubella is a mild rash. If you're pregnant, you're highly at risk, and you can develop birth defects. Whereas, and it affects the fetal tissue. That's where replication occurs for Bella. So just think Bella, fetal tissue, replication, which is not Bella, which means beautiful. And then Bola, which is rubella, that's Ruboela, is you have a macular rash, fever, and a cough. You have Koplik spots. So that's the Koplik, the spots. And then the thing is, it's secondary. You can get pneumonia or encephalitis. So that's the main difference. And I drew a picture of a woman who's pregnant. So you can think of Bella
So,
pregnant.
How's it transfer to the?
Congenital rubella. What is that?
Congenital means you get it at birth.
So,
Congenital,
rubella syndrome, is that like something you notice in the baby or something?
yes, and that's what can cause birth defects.
Does it go through the
See, look at my pregnant woman. Come look at her, so you can remember. So this woman's name is Bella. She is highly at risk for birth defects if she contracts rubella, but it's different from rubella, which is measles. Because they both look both the same, but this one is different, right? This one is for measles virus, this one is rubella virus, but they sound the same. So if she doesn't use the word measles, then you have to be able to know that, okay, rubella or measles is associated with fever, rash, cough, Koplik spots. What did I say special about the spots? Macular?
Oh, no, yeah, it's
Which
birth
one?
defects and possible mental retardation of the
Birth
child.
defects and possible. Yeah, I forgot. I didn't
How
even
do you
think.
prevent it? Your congenital.
Vaccines?
That's what I meant before.
Yeah.
Because the question here says,
Vaccine is available.
so there's.
Congenital rubella syndrome. Bioreplication, fetal tissue,
Remember
birth
like
defects.
last week how we were talking about how people don't vaccinate their kids? I
Yeah,
bet my cousins don't.
tell them.
And I tried telling them, they're like, well, so-and-so's the mom's brother or something like that.
Yeah.
Because they had a kid and it was autistic because they had the shot. And I was like, come on.
Oh, no. I think they disproved that. And the scientist retracted his statement. Oh, I just wouldn't want any, oh. I called my brother, and because I'm an aunt now. The best aunt, by the way. Anyway, but yeah, I have my little baby niece and I love her so much. And when I found out that honey can cause the floppy baby syndrome, that made me like, I called him right away. I was like, I know she's still on the boob, but as soon as she's off of the boob, don't give her any honey until she's like grown.
I did not realize that either.
I didn't know that either. So now I know that I cannot get that one on.
Floppy baby syndrome.
No, what kind of honey? I thought she was very.
Any
specific.
honey.
Is it just any honey?
Because it has a possibility to have endospores. So just think honey, baby botulism. It's an infant botulism that can cause the floppy baby syndrome. I can't get that out of my mind now because I love my niece.
I was thinking.
Why would you want
I
to eat
thought-
artificial honey?
well, I
Yeah,
thought
why would you want to
it
pay
would be natural?
High fructose corn syrup?
I don't know.
Bro, I've had an actual honeycomb from a hive.
Ooh,
That shit's good.
I bet.
Oh,
No.
That right there, that
Sometimes
probably
they-
has
sometimes
endospores.
they pasteurize honey though. Did the
That's true.
Do the endospores
Some
make
do.
it through that?
I think so.
not sure. I think the ones that you were talking about were like highly resistant.
Next question.
It looked like you for a second. I was like, this dude's staring at me. It looks like Tony.
What's up,
This
guys?
is good.
How you doing?
Next question.
Necrotizing fasciitis. How did I say that?
Necrotizing fasciitis.
Okay.
Fascia eating. Zombie.
List the most causative.
No.
I love that
Agent.
for that slide too.
The most causative agent is S-pyogenes.
Aspiraginase.
Yeah, like MVP, remember?
And describe the symptoms now.
The symptoms are a severe pain with rapid progression in the deep cutaneous layer. Next,
Gas. Angry.
what about it?
Causative agent.
The causative agent for gastrin is C. perfringens.
Major virulence factors.
The major virulence factors for C. perfringens is endospores anaerobic, and they have toxins.
For gas. Are we
And-
on gas one?
Yeah, and it makes
So
gas.
what'd you put? Spore forming?
Endospores,
Anaerobic
anaerobic toxins.
toxin.
It grows in low O2, but you can fairly say anaerobic growth.
Okay,
Do you agree?
nice. Yeah, I agree.
Okay, great.
Explain how
They
it is
differ.
treated.
So the huge difference between S. pyogenes, which is necrotizing fasciitis, and gas green, which is C. perfringens, is the fact that C. perfringens or gas green, you have to treat it with an antitoxin. It can be treated with an antibiotic as well, but NF, necrotizing fasciitis, can only take an antibiotic,
So it's just
even though it
like,
produces toxins.
what about surgical removal?
Surgical removal? Oh, both of them. But the thing is,
Very
I could be
true.
wrong about this, but that's what it says in the lecture. So I'm just going by what the lecture says. That the antibiotic is for necrotizing fasciitis, and the antitoxin is for gas green. Because look, gas green is the worst one. It's like you got endospores. Really? Because look, with gas green, you got endospores, growth in low OT, toxins. They destroy the immune cells, hemolysins, cell growth, necrotize. Gas green that it has it grows in the necrotic tissue, so the tissue's dead and it grows like happily, and then it can necrose the muscle. You got pain, swelling, gas. Like that one's the worst, you know, because they are so similar. Because both of them have to do with necrotizing tissue, but this one has gas and grows. It's just disgusting. Gangrene.
Gas, gangrene.
Yeah, gas gangrene.
Okay.
What did I say?
You keep saying gas green, I just wanted to make sure.
Oh, I'm sorry, gas green.
I did.
Yeah.
I'm like,
I'm sorry because I'm trying to do green. I'm trying to like shove it into my memory
That's funny.
because it's green and I'm writing in green and I'm looking at green even though it's gas gang green. It's just an actual extra gang member. Next question. Thank you. You always help me out.
Positive agent.
The causative agent for the tetani is Clostridium tetani.
Nice. Okay, and tell me the effect of the toxin.
This is horrible. This is bad.
Spastic muscle contractions.
Nice.
Locked jaw usually.
Of course you know this one.
Yes.
Talked about it.
Yeah.
Yeah. Locked
Okay,
up.
so identify the type of vaccine for this.
The type of vaccine, what? Antitoxin and toxoid vaccine.
Toxoid vaccine.
Yes.
Does not work on newborns, apparently.
It doesn't?
No, not for under 1 year.
Oh my gosh.
Newborn.
I gotta write that down.
It's the same company that dropped my
Dude, how can it be almost 1 o'clock and it's still too early in the day? That's how I feel.
Yeah.
Okay, so we're done with chapter 22.
Really?
Yeah,
And
I do
23.
agree.
Oh, perfect.
So I feel like you've mastered it.
That question is not right, but okay.
Where do you want to go
I
next?
feel bad.
Should we do some second questions or?
Let's just do my question.
Okay. So name,
Such a late start. I was like,
yeah, have you gone through everything yet or no?
No.
Who has?
I brought flashcards. That's all I'm doing today. Make flashcards.
I was gonna do,
Thank you guys for joining. Bye.
That's all.